So the key for me is it's just looking to start off with. It's that sort of look, feel, move thing. And so I would have watched Marion get up on the chair, or rather up on the couch, because you can see how your patient moves and you can see how uncomfortable they are. So you might have a patient who says, "Oh, you won't believe that, I'm in terrible pain, doctor," and then forgets that she has the limp when she gets onto the bed and jumps up, and so she's not in that much pain. Okay. Okay, so looking at Marion, it's great to be able to look at her from the end of the bed, and you can see the little curve she's got in her tibias, both sides, okay? And then I actually do say to them, you've got one finger, okay, to show me where your pain is, and she's going for here, okay? Now I can probably find that. Is it just there? Yeah, okay, right. Got it. Okay, so, and that's it's worthwhile trying to find out. So it's on her medial joint line, and her medial joint line, just by feeling it, is swollen. And you can probably feel that little lump I'm rolling over there, okay? So she's got an osteophyte there, okay? So as soon as you see or feel an osteophyte, by definition, you've got two bones rubbing together, because that's how they're made. It's the bone debris from the rubbing together spat out the side of the knee, and she's got an osteophyte there. If I do the same thing here,
no.
Doesn't hurt. Okay, all right. So I've looked at her knee. I can see that it's a little puffy. We've noticed that it's a little varus. We've asked her where the pain is, and we've been able to verify that is where it is. And briefly, I'm just going to come around this side, okay? And so I'm going to say, push my hand against the bed. Stop me taking my hand away. Pathetic, okay? Okay, so...
You're going to go away so depressed, aren't you?
Right, so the issue is here. That's a really nice way of looking at it. It's not really pathetic, but what we're looking for is her loss of extension, okay? So as these two bones are rubbing together, you will lose that ability to hyperextend the knee and flatten my hand. You should be able to keep my hand there. And you were close, but not close enough. So what we can say now is that she's got a varus malalignment, she's got pain on the inner side of the joint, she's got a palpable osteophyte, and she's losing her extension, okay? We haven't even moved the knee yet, but we've learnt all that already, okay? And then we do the same trick with popping a hand over the knee. Now this knee is cool, okay? But it's a bit squidgy, okay? So there's got a bit of fluid in it, so she has an effusion in it already. And people talk about different ways of measuring effusions, but I mean, you can just feel it's squidgy. People talk about pushing this down and then doing something called a patella tap, okay? And you've got a patella tap, okay? We can make the patella make a little noise when we bounce it up. So what we're doing is floating the patella up on her fluid and then pushing it down and feeling it touch the femur, okay? So it's a pretty swollen joint, okay? Just lean back for me a second, man. And what I'm going to do, so now, it's only now we're getting onto the move bit, okay? So what we'll do is just ask her to bend up the knee, and just bend up the knee how much you feel. So flexion is pretty good, okay? Tough goal, that's great, okay? And it's always better to get them to do it rather than you do it, because you don't know how stiff they are, and sometimes you can cause pain by trying to push the knee for them. And then I'm going to let me do it, okay? Yeah, and she does flex very well. So she would, that's flexing to about 140. No wonder you're good on this side, okay? All right, come back again.
So she's making it up then, basically.
Yeah, she's making up.
Well,
Sit down.
Are you okay with that pillow? Do you want me to move that up?
Yeah, that's right, that's great. And just sit yourself back so nice.
Okay.
And then the other thing that I'd want to do is just see how much she corrects. And pop that down for me, Aaron, okay? And so we've got this varus malalignment here, okay? And what I can do is just relax and let me take the weight of the leg, man. Just go all floppy, okay? And I don't know if you can see, but can you see I can correct? That's her varus malalignment.
Yep.
And I can actually correct it. She should be out here, okay? So that means she's chewed up all the inside bone, and so that means the varus is getting worse, okay? But she is entirely correctable. That's where she should be, okay? That's where she is, okay? So what we've got now is a knee that's pretty much worn on the medial aspect, secondary to a varus malalignment. It's got painful medial joint line. She's got osteophytes on the joint line. She's got a restricted extension. She's got very good flexion. And she has a correctable varus. Well done.